huge shift happens in social media. Before, the only way you knew like what looked good is if you had to trust whoever was doing it.
Mm-hmm.
Now you can get access to thousands of examples of good and bad veneers. So what we see a lot now is that people have a really good idea of what they want. And I think it's important that the doctor that you see is open to listening to what you feel is best for you.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Hello, Melissa.
Hello there, Selah. How you doing?
Good. I just love your gorgeous smile.
Oh, you're so kind. And these are all my teeth.
Love
now.
it. Now, okay.
Some you can't tell though, can you? No. Which ones are what?
Wait, they are all your teeth? That's so...
Well, I mean, kind of. What I mean by that is like some of them, you know, I've had crowns, root canals, all the things. And so, yeah.
All the things.
All the things. What I haven't had though, veneers.
Okay, I was going to ask you.
I'm so glad that we're going to be talking with the Harris brothers today.
Yes, they're the experts.
They are the experts in that. And I've heard, and I'm sure the Harris brothers will confirm this, but that you have to get them replaced like every few years or so. Maybe it's like 10 years. Like the lifespan of veneers isn't the same as like your real teeth growing from it. Yeah.
Oh, to have to go through
But I might be wrong. I mean, the Harris brothers will tell us.
Yeah, they'll tell us. And I wonder how painful that is, too.
I don't
sounds
know.
Not fun.
I wonder what the whole process is like.
I know.
Getting them and all that, and who's a good candidate.
Let's find out.
Yeah, let's talk to the Harris brothers. Dr. Brian Harris, also known as a smile creator, confidence builder, and educator, is one of the nation's leading experts in adhesive dentistry, cosmetic dentistry, and creating the ultimate patient experience.
Yes, and his brother is Dr. Scott Harris. He has practiced as a cosmetic dentist for over 17 years, but his career in dentistry goes back much further.
And Dr. Brian Harris is the creator of the Smile Virtual software platform, which allows doctors to attract and treat more complex cases in their practice.
I love that.
Me too.
Dr. Scott Harris is a founding member of the Elite Academy and lifetime qualified member of the Crown Council.
So what you're saying, I guess what we're both saying, is that the Harris brothers are very qualified to have
know
these
what they're doing.
conversations
Yes.
with us. Yeah, I can't wait to talk to
Me
them.
too.
Yeah, and find out more about veneers.
Yeah, let's do it. Let's bring him in. Come
on
on
in,
in,
Harris brothers. We are joined by the Harris brothers today, and we are talking about veneers.
Yes.
Had you ever heard of veneers before the last like 5 or 10 years? 'Cause
Well, I had because a friend of mine did them a long time ago, and I feel like, thank God, they've advanced since then because his were very obvious to me.
which is not the look.
No, but we should start by saying Dr. Harris, the two Dr. Harrises,
Yeah,
the Harris brothers,
Harris brothers.
are brothers, dentists together in Arizona, and you are actually 2 of 4 Harris brothers that are in the dental field, right?
Yep. So my dad was a dentist. Growing up, we were able to see the way that his practice was transformed by doing cosmetic dentistry. It was a big confidence boost to him. And just seeing the way that he was able to change other people's lives through that process is what got me into dentistry.
And cosmetic dentistry, too.
Specifically,
Wow.
yeah. Let's start with the basics. Dr. Brian, what are veneers?
So porcelain veneers are essentially coverings that go on top of your existing teeth, and it allows you to change color, size, shape, position. So you can essentially design a brand new smile. So there's kind of, the way I like to explain it, there's kind of 2 different ways to look at it. Like a smile upgrade, that's when you do like 4 veneers, 6 veneers. It's like taking your own look and just making it look better.
Okay.
A transformation is more of like, that's when, you know, the
Full
teeth,
mouth.
the teeth that show within the smile. And most of the time people are going with a brighter color because it's like permanent teeth whitening. You don't have to worry about constantly whitening your teeth. But a lot of times it's for those looking for just something new. You know, they don't love their smile and they're looking for something brighter, fuller, different size, different shape.
And not all cases that we do are for cosmetic purposes.
Oh.
We see a lot of people that have a lot of wear and tear, things are broken down, or they've had a lot of decay on their teeth over time. And so sometimes it's just rebuilding people's teeth back to how they were as things break down and their teeth start to look bad and hurt them.
Chips and
Yeah.
stuff like that, cracks. Yeah.
Exactly.
Who is a good candidate, Dr. Scott, for veneers?
So, I mean, really anybody, veneers are a great way of improving the smile. And so sometimes we're focused on smaller areas to make smaller changes. The things that are more difficult to treat are when the teeth are really far out of alignment. We're not going to be able to get them completely back into alignment. A lot of times those people are still candidates, but we'll usually do something like braces or aligners to get things back into alignment before we do the veneers.
That makes sense. Okay, I have to ask because both of you have beautiful teeth. Do either of you have any veneers?
You put us on the spot.
Oh, they're gonna
And did you do each other's?
He's the natural one. I do have veneers on my teeth. Yeah,
They look so
They look
good.
so
I
good.
never would have known.
I hope people watch this episode
Yes,
to see.
they can see. Yeah.
If you look at our teeth, my teeth are shorter. I grind and clench, so I've worn mine down a lot. And so that's on my to-do list. Like I'm going to have Brian do my teeth.
So you do
here
each
pretty
other?
soon. Yep.
That's incredible. I love that.
What is the process like
Yeah.
for getting veneers from top to bottom? Well, not just top to bottom, but beginning to end.
Yeah.
So I'll go more like traditional, and then maybe I'll do like the whole prepless, non-prep process, because I think they're different processes, but they're similar. So the traditional process is you come in to see a dentist, you have a consult, you discuss kind of what you want to do, how many teeth you want to have done. Once everyone's on the same page, then it's a matter of prepping away some of the enamel to make room for the veneer. Sometimes if you don't do that, then the teeth can look too bulky or they don't look right. You don't have as much control of the final outcome. So like if you had one tooth that's flared out a little bit more, you'd bring that back so that the new veneers don't sit flared out more like that.
Oh, that
Okay.
makes sense.
So it's one appointment to like prepare the teeth to get them ready, and then temporary veneers are put in place, and then you come back a couple weeks later, temporary veneers are taken off, and then the permanent veneers are bonded in. And so that's the process. There's some new stuff happening with minimal and what they call no prep veneers. I'll let Scott take that one.
Yeah. So sometimes you do have to adjust the teeth to get things to look good, but you don't always have to do that. And if the teeth are in relatively well, if they're relatively well aligned and we have the space to put the veneers over the top, you can do more of like a minimal prep or a no prep veneer case, which basically we're able to place the veneers over the surface of the teeth without doing any or very minimal adjustment to the teeth. Not everybody's a candidate for that, but it is an option for the people that it does work with. And with that, it's kind of the same process. We get impressions, but there's a lot less work done on the teeth. Typically, people don't need to be numb for it. And so the whole process is a little bit easier and smoother.
Getting veneers, though, from what I've heard, and please correct me if I'm wrong, is irreversible, especially if you've had to have them grounded down, right?
So it's a big topic right now.
Yeah.
So this whole idea of minimal prep or no prep veneers is really trending, especially like on social media right now, of just, hey, you can just build off of what you have without having to grind things down. But the reality is once they're bonded in, they're yours. So the only way to take them off is to grind them all the way off. But so it's kind of one of those things that, once you commit, like you commit to making changes, there are ways to do it where it's reversible, but the materials are they don't last as long. Sometimes they don't look as good. So it's a big decision. We always tell everybody like, hey, this is a big deal. Like it's your face, right? It's your smile. It's not something you can
Plan
just
it
cover
right.
up. And so like take the time, really think it through, get all your questions answered. And when it's done right, it's a pretty amazing process.
transformative.
Yeah, it really is. It really is.
And I'll add to that. With all the veneers that I've done, I've never had somebody say, I wish I wouldn't have done that. I want it reversed. It's always like, why didn't I do this sooner? And so, yes, once it's bonded in place, it's really hard to get them off. So it's hard to say that it's reversible, but yeah, when the patient is ready and we do things the right way and communicate well with the patients, communicate well with our lab technicians, our ceramists that are making the veneers, we get great results, and there's no reason to go back.
Wow, that's it. Are there any side effects after with veneers? Or you said that you can't get cavities with a veneer, but with the gum receding, or what are some things that could happen after you have veneers?
So you can't get cavities on the porcelain.
Okay.
Where the kind of porcelain meets the tooth, you can still get a cavity there.
Okay.
I would say the biggest things are, if they're not done correctly, or even sometimes if they are done correctly, like some of the complications are like you can have teeth sensitivity after. It's usually fixable. It's usually related to like the bite not being right or things not being done correctly. But I think it's like any elective procedure. I don't think it's fair to say like, oh, it's great, there's no side effects. There's always things that can happen.
Okay.
It's just knowing the risks. And I think it's also like minimizing the risks.
Yes.
Going into it with a good plan so that you do it right the first time, so you don't have to like redo it, or you don't have to deal with complications.
Okay.
When you plan things out really well, you can typically avoid a lot of that stuff. We've done a lot of veneers between he and I, and yeah, some things can come up, but we've overall had very few issues with
That's great.
the veneers that we've done.
What is the expected longevity of veneers in someone's mouth? I'm sure you're going to say it varies from person to person, but go ahead, Dr. Brian.
No, it does. It does. But I think the safe answer is like 15 to 20 years.
Oh, okay.
Because they've kind of truly been around since like the mid 90s. Like, I think it's fair to say that. But when they are done right, they really can last forever. They become part of like your own tooth. Usually the reason someone would redo them would be like if the gums have receded and now they want to have a different look, or if they did 4 in the front and now they're ready to do 10 and they want to go with a brighter color, or they did the tops and now they're ready to do the bottom. So it's one of those things that
Like you want an upgrade, you said.
it's like an upgrade.
Okay.
It's kind of different from other aesthetic procedures because most cosmetic procedures, you like do like one thing. You don't get like half a rhinoplasty or half a breast augmentation, but
Oh, you don't.
like with teeth, like you can phase it out. Like you can start here and then come back and add more later. It's you can kind of build on itself.
So if you want them to last longer, what kind of practices do you put in place to make sure you create longevity for your veneers?
So veneer care.
Yeah.
I like
Yeah,
that.
veneer
Veneer care.
Either there's the stuff patients, or like whoever's going through the process, they can do on their end, which is brushing, flossing, seeing a dentist regularly, wearing some sort of like night guard or retainer to kind of
So you don't
protect
grind.
things. Yeah, so you don't grind them. So there's that. And then it's also, I believe that a lot of the issues are really more avoided on the front end in the design process and just planning it out right, making sure that you do the right numbers of teeth, making sure that they're designed right on the front end so that you don't have issues on the back end. Because you hear stories, like horror stories of people's teeth popping off. And it's like, like
Imagine.
You hear horror stories. I don't want to hear any of those. I don't know.
you hear often, like a lot of people have a friend where something happens, and
Yeah.
it happens, but a lot of it can be avoided.
Is there anything you should avoid eating or drinking wise when you have veneers?
So once the veneers are bonded in place, with temporaries, it's a different story. You want to, be cautious when you have the temporary veneers on. But once the finals are bonded in place, you're going to be able to eat and chew the things that you want to. Things that can cause issues if you're chewing ice, biting hard candy, stuff that, can break a tooth can also break a veneer. And so you just want to be cautious with things like that. I've had patients as well that have chipped veneers and teeth doing things like biting fingernails, tearing tags off clothes, using their teeth
I do
as
that.
tools. It puts a lot of pressure on those thin edges, whether it's a tooth or a veneer or a crown.
Sure.
It can put pressure on that edge and it can cause things to chip or break. So just avoiding using your teeth as tools.
Okay. Note to self.
That's the
Note to
main
self.
thing. It's more that than foods.
I always wondered though, when it comes to veneers, do they stain differently? Because people drink coffee, people drink red wine,
right.
other things that are brightly colored.
They
Marinara.
don't.
Marinara.
And that's why we call it permanent teeth whitening. They don't stain. So the porcelain doesn't stain.
so cool.
And the thing you have to take into consideration there is if you, let's say you have just some in the front, the other teeth naturally will stain. And so it's something you have to just be aware of.
Yeah.
But you know, they're not going to stain like normal teeth, but on the flip side, you can't whiten them like natural teeth.
Oh,
either.
right.
So
Okay.
it's important to choose the right
The
color.
right color.
Sure.
Yeah. I think there was a time in cosmetic dentistry where the dentist controlled the process. It was like, I'm the expert. I'm going to tell you what's going to look good on you, and that's what you're going to get because I'm the expert.
Yeah,
right,
I went to dental
Yeah,
school.
yeah.
You did not. I know more
Yeah.
than you do.
So-
I'm doing the work.
Huge shift happens in social media. So, 6-7 years ago, social media is out now. So before, the only way you knew like what looked good is if you had to trust whoever was doing it. Now you can get access to thousands of examples of good and bad veneers. And so what we see a lot now is that people have a really good idea of what they want. And I think it's important that the doctor that you see is open to listening to what you feel is best for you.
Do y'all like that when someone comes in and they have pictures of other
Yeah.
people like, oh, I
Absolutely,
like
yeah.
this?
We encourage it.
Yeah, and whether it's his work or another dentist's work, I want to know what they want so I can deliver on that. Because what looks good to some people doesn't to others, and you can see that if you look at our Instagram accounts, you can see that some people's teeth, like some of the work that we post, it's really square, really bright, minimal translucency. You know, they tend to look a little bit more fake, but that's what the patient wants. Other people, they want the teeth to be less noticeable. They want to brighten things up, you know, broaden the smile, whatever we're doing, but they want it to be done in a way that's a little more
Natural.
Yeah. And so when you look at the cases that we put on our Instagram, you're going to see a variety of different things based on what that individual patient wants.
Dr. Brian, what is that like for you when someone comes in and they're like, look, I want veneers because I am looking for an overall cosmetic change. And you see them go from not really liking their smile, not really being comfortable with the way their teeth look, to you doing the work and them seeing like, wow, what is that like for you?
I mean, it's powerful.
How so?
It's powerful in the fact that you see people going through life like down a certain path, and that path can be filled with lack of self-confidence, lack of self-worth, and there's one party it's like, well, we should just love ourselves for who we are and not worry about those things. But there's the other like real side of like, if it's something that really impacts you and there's a way to fix it, you know, and you go through that process. So I think what's really cool for us is to see that change happen, and like people show up differently in life. They show up differently, you know, professionally, personally, in relationships. They kind of step into this new version of self-confidence that I think is a powerful thing.
Now we're talking about veneers, and we all know, I mean, especially y'all, that veneers are not cheap.
Right.
They can be very expensive. What is the price range, and how do you help patients who want to get veneers afford them?
I think transparency on cost is super important in this world because there's a lot of confusion around it.
For sure.
And the reason there's confusion is you know, I know doctors in Beverly Hills in New York that are charging like $4,000 per veneer.
What?
So like 10 veneers, like $40,000, a whole mouth, like
had
$100,000.
no idea.
cases. Yeah.
Oh my
$100,000.
I know. But then you also have dentists that are really talented, you know, that are charging, let's say, $1,200 per tooth. I'm giving like real numbers because
Sure.
I want to be super transparent.
We
here.
appreciate that.
Yeah.
And I think, but then you also have, you know, some places you can go overseas and have it done. I think the key is like just finding somebody who you trust, but also finding a price point that works for you, because you know I would say on average, you know, to get veneers done right and have them look good, it's going to be somewhere in that $1,800 to $2,500 range per tooth. So it's a big investment. It's a big investment, but it's also like it's an investment, right?
Yes.
It's your smile, it's your life. You almost have to look at it like, okay, I'm investing in myself, and because of that, this is what it's going to allow me to
Business
do.
is going to be better. My relationships are going to be. I'm
My
gonna feel-
self-confidence is going to be better.
Yes.
How do you make that more accessible?
That's one of the main reasons why a lot of our patients will use the CareCredit credit card, and finance treatment so they can pay it off over time. I think an important part of it too is just talking through that part of it. Because let's say somebody needs 10 veneers and what works with their budget right now is 6. It's coming up with the plan with your dentist. We're like, okay, how do we make this work? And is there a way to do 6 now and add more later? Or are we better off just like waiting and doing? So just talking openly about that if it starts to fall outside your budget to find something that does work. But financing treatment is huge. It's something that a lot of patients do because it is a big investment.
And I've had patients where I know for a fact that they could afford it, executives of companies and things like that, where I know like they're doing plenty well and
They're fine.
they could pay out of
They've
pocket.
got the budget for it.
And they'll still choose to use CareCredit to finance things just because the option is there.
It's a good option.
And it's if they can pay it over a little bit of time rather than paying it up front, they choose to do that.
Right. Why wouldn't you?
And obviously, y'all are in the business of helping people. And when you're able to offer that financing option, you can help more people.
That's right.
Restore more smiles.
What are the pros of veneers compared to other cosmetic dental treatments like dental bonding, teeth whitening? You talked a lot about permanent teeth whitening with veneers. That may be one. Dental crowns,
And orthodontics. Yeah.
the Invisalign.
So veneers, you're going to be able to make a much bigger change. So you can do something simple like whitening, do some little shaping of the teeth. But if what you're looking for is a bigger change, what you're looking for is an overall brighter smile or a straighter or better proportioned smile, then veneers are going to be a better option for you.
But you would be able to tell, like I've noticed, without putting a spotlight on my teeth, that I have very pointy, what do they call these, fangs?
Canines.
Yeah, canines. And I wondered, should I get these shaved? But what would you recommend to someone?
Oh, free consultation. Go ahead.
Consultation.
Open that mouth, let them see.
Okay, so we'll simplify it. Well, we have a procedure we call smile shape, and that's for people that have good teeth, but they have a super common one will be, let's say the front 2 are longer than the rest, or the canines are pointy.
Yeah, I have that.
So it's cosmetic dentistry, but using your own natural teeth and reshaping and perfecting. So it's kind of a combination of shaping, changing gum heights, and whitening the teeth. Super affordable though. I mean, when I say super affordable, like the whole process, the most extensive cases under that $2,000 mark.
All right, I'm coming to Arizona.
I know.
So that's
my
becoming
plane ticket.
more and more popular because it's something that you can go next level with the smile without having to go like make a massive investment, but also without having to like change or do something drastic.
Right, like I don't feel like I need veneers per se, but I would like to shave these little canines.
So that then next step is like then it's more like whitening and straightening, and that's going to get you into that like $5,000 to $7,500 range, depending on complexity of like now straightening and whitening teeth. And then the step up from there is that's when you get into like 4 or 6 veneers and then 10 veneers and then full mouth. So it's there's options. I think it's just knowing your options. It's super common for people to come and do like 10 veneers on the top, and then we'll use smile shape on the bottom teeth to kind of perfect, because oftentimes the bottom teeth can look a little uneven or crooked.
Yeah.
And it doesn't mean that you have to have braces or Invisalign. Sometimes it's just reshaping and polishing and changing what you have.
When you get veneers, you still have to come in for regular appointments and
that's a
dental
great
cleanings,
question.
right?
Yeah.
Yeah, so you want things to last a long time. You've invested a lot in what you're getting, and so you want to preserve it and keep it healthy. And seeing a hygienist regularly is ideal. Taking care of things at home on your own is ideal because you can't get cavities on the veneers, but you can get cavities on the back side of the tooth. You can get gum disease still, and so you've invested in creating an amazing smile, and so preserving it and keeping it healthy for the long term is ideal.
Oh, and do veneers feel different in your mouth? You know how when you get your teeth cleaned, have this like really
Feels
slick,
so
it's so
good.
clean. It's like
For like a day, for like an hour.
Do veneers feel squeaky clean all the time, or is there a difference
The idea is to get them to feel as much like natural teeth as possible.
Oh, okay.
But they can, like when they're first place, let's say they're still a little bit rough from how we bond them in place. Like they can feel a little bit rough in areas, but that can be polished out. So, but in the end, the goal is like get them as natural feeling as possible so they don't feel different.
You know what time it is?
I do. I'm
Go ahead.
excited.
What is
It
it?
is time for Ask the Expert.
This is when our listeners and viewers anonymously submit questions, and well, you're the experts. We get to ask them for them. So here's our first one.
All right. Are veneers painful to get? How much discomfort should I expect during and after the procedure?
That's a good question.
Yes, Dr. Scott, you take.
We want to minimize that. So you do have to get numb typically when you're adjusting on the teeth. So I numb my patients so they're not feeling anything else. People usually say getting numb is like the worst part of the process.
Yeah.
But once you're numb, the rest of the appointment is comfortable. Sometimes people will have a little bit of sensitivity with the temporaries on. Not always. I mean, I'd say maybe 20%, 30% will have just a little bit of sensitivity for a day or so after. And then when we bond the final veneers on, we do the same thing. We numb you up. We get things done comfortably. And then after that, very low chance of sensitivity after that. So the whole process is relatively comfortable. We have a lot of things to keep people's mind off of the work that we're doing, whether it's a blanket, headphones, people throw on music or their favorite podcast, and they're able to just sit back and relax. I have a lot of patients that just fall asleep while we're working on them because they're comfortable.
I probably would fall asleep, actually.
I have never fallen asleep during it. I'm telling you that right now. Okay. You spoke about sensitive teeth. This person says, I have very sensitive teeth. Will veneers help with my sensitivity? Dr. Scott.
So possibly. So it kind of depends on where the sensitivity is coming from. A lot of people will have recession where the top part of their tooth is exposed and they'll have general sensitivity from that. And if we can do the veneers to help cover that up, then yeah, it should help with the sensitivity. Sensitivity could also be coming from issues with decay or other problems like that. And yes, if we're removing the decay and replacing it with porcelain, then it can be a good solution for reducing sensitivity on teeth.
What's the youngest age you would recommend getting veneers?
I love this question because I think, for me, for example, I have 4 kids, right? My 2 older kids have veneers, and because they have small teeth and they had spacing, and I knew that we could comfortably do it without having to grind down the teeth, without having to damage anything. And I mean, I see how powerful it can be to have a confident smile. And so I think sometimes we'll see patients that are 15, 16 years old. Yeah. And but it all comes down to how it's done.
Okay.
At that age, we don't want to be numbing up, grinding teeth down. You don't want to be doing it because the body's still growing. Things are evolving. But with some of these no prep options where you're just adding on top of, then it can be done at younger ages. I think ultimately a lot of times it's more of a financial decision because it is a big investment. It's maybe not something you want to do too young,
Right.
But I think it's so situational too. If you have somebody that you feel like it could really help them emotionally where they're at, or if it's something that is impacting them at school, or there's bullying happening because of some situation, things can be done at younger ages. We just have to be more conservative in how we do it.
That makes sense.
Yeah.
This person wants to know, how do I decide between getting veneers or implants? What factors should I consider? We're going to stay with you, Dr. Bryant.
Okay. So implants and veneers, let's talk about like all the teeth replaced with implants in. That is a good option for somebody who has, let's say, already 6 or 7 missing teeth on the top and there's some bone loss. And you get to this point where it's like, okay, if we put veneers on these 8 teeth that are left and then we do individual implants and then implant crown, you get to a point where all of a sudden it's like, oh, well, now we're $80,000, $90,000 to fix somebody's smile.
Okay.
Where the implant solution is emotionally, you have to make that decision of, okay, I'm going to have the rest of my teeth taken out and implants in, but that can be done for like $25,000 to $30,000 per arch. So somebody can replace their entire mouth for like it's still a big investment, but
Sure.
but less than just doing a little bit in combination with veneers. So I would say it's one of those where if the bone's good, teeth are healthy, do not go the implant route. Do not have your teeth removed to have, to save on money and replace them. But if you've already have a lot of missing teeth, the chances of them lasting aren't great. That's where you kind of make that decision to like move in one direction versus the other.
Okay, wow. This person asked, can I get just one veneer or do I have to do my entire smile at once? Dr.
Yeah,
Selah?
so the answer is yes, you can get one veneer.
Okay.
And I did one yesterday, actually.
Oh, wow.
A patient of mine that had broken one of her teeth, and I did a single veneer on her front tooth to match the other side. That being said, matching two front teeth is probably one of the most difficult things we do in
Sure.
dentistry, especially when it's a natural tooth and you're adding a single veneer. But it can be done, and if you have a great lab technician, and you can match things and blend things as close as possible. So yes, it is an option.
Here's the last question. How do I find a trustworthy doctor to do my veneers procedure? What should I look out for? Dr. Brian.
I think the best way to find like a really good doctor is do your research. I think what's different now than how things used to be, like do your research before would mean you go online, you got to sift through all these doctors, you got to go in, you got to spend money, you got to take time and talk with them, and then you still really don't know. About 5 years ago, Scott and I started doing these free video consults for patients.
Oh.
And the whole concept or the idea is that people can send a photo of their smile, tell us what they're looking to change, and that's it. And then when we have time, we'll sit down, we'll record a video, send it back to them. So it's not live. And in that video, it's like, hey, here's your options. Here's exactly what it's going to cost. Here's what I would do. And it's done from a place of like really trying to just serve as many people as we can.
Yeah.
So nice of you.
I know.
So
right? I'm like,
generous.
wow.
Yeah.
Well, and what happens is we know as we record it, there's people on there that maybe have no intention of traveling all the way to Arizona to see us, but a lot of people do. But it's just the idea that, if they at least know what's possible, then they can decide what they want to do. So I think, I guess my challenge would be, look for somebody whose work resembles the kind of style that you're going for, and then reach out to them. And if they'll connect with you virtually, if they'll give you some information first before you go on, I think it's a great way to just kind of feel out what is important to you and then make a decision off of that.
Yeah, that is so, wow. The
I know,
video.
so generous, as
Yeah.
you said. Yeah. Is there
amazing.
anything we didn't ask you that you'd like to share about veneers?
I guess in closing, I would just say that, it is a big deal. It's your smile. Patients should feel empowered to have a say in how things look. And I think as long as you communicate, like we talk all the time about, like success in cosmetic dentistry is way more about communication, I think, than it is about skill. It's just making sure that you give somebody exactly what they want. I think that's the most important part of the process.
Thank you both so
Thank
much for
you
being here
so
and for being so
much.
generous with your time and with your skill set. We appreciate you.
You're welcome.
Definitely.
Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.